Welcome to The Point of View. This is your favorite current affairs show on television. Here on The Point of View, we pick the right topics, we get the right guests, and ask them the relevant questions on issues that matter to you. Tonight's show is live and interactive. It's dedicated to COVID-19, and welcome to the month of February, by the way. If you want to contribute to the show, you have a question to ask, please send it through the WhatsApp number on the screen. And if you want to also comment on the stream, if you're watching on social media, please feel free to join us. So it's a big conversation on COVID-19. It's back on the big burner and the cases are rising. I'm going to be speaking to three very different but related people in a sense. They are all from the medical field to try and understand why COVID-19 has become a big issue almost a year after it emerged. I'll tell you who they are when I come back. Stay with us. Welcome back to The Point of View. So last night, the President of Ghana, Nana Kofi Quakyi, announced new restrictions to try to bring down the marauding COVID-19 vaccine. This includes a ban on parties, a ban on some social gatherings like funerals, and also a tightening of some of the existing issues. We'll hear briefly what he said, and then I'll tell you who my guests are. This is the President speaking to the nation last night.
We have a lot of work to do in coming to grips with the disease. Given that recent studies show that the UK and other new variants are being transmitted within the population, we should all understand that our current situation could get very dire if efforts are not made, both on the part of government and by you, the citizenry, to help contain the virus. The analysis continues to tell us that the spread of the virus mostly occurs in indoor confined spaces with poor ventilation, where people are talking, singing, or shouting without their masks. The imposition of restrictions on our daily routines helped in reducing the prevalence of the pandemic in the country, and government has been left with no option but to reintroduce some of these restrictions in order to help save the situation. I know these measures in the recent past were unpleasant, but over a period, they resulted in a favorable situation for the country. We have to return to them. So, fellow Ghanaians, until further notice, funerals, weddings, concerts, theatrical performances, and parties are banned. Private burials with no more than 25 people can take place with the enforcement of the social distancing, hygiene, and mask-wearing protocols. Beaches, nightclubs, cinemas, and pubs continue to be shut. Our borders by land and sea remain closed. All workplaces, public and private, must employ a shift system for workers, in addition to the use of virtual platforms for business or work. Conferences and workshops can take place with all the appropriate protocols. However, I encourage the use of virtual platforms for such engagements. Restaurants should provide takeaway services and should, as much as possible, avoid seated services. The National Sports Authority and the Ghana Football Association should ensure compliance with the 25% capacity rule in our stadia, with spectators respecting the social distancing rule and wearing of masks. To the revered leaders of our religious organizations, that is our churches and mosques, I entreat you to enforce to the letter the protocols relating to attendance, i.e. the 2-hour duration, 1 meter social distancing, mask wearing, use of sanitizers, and the presence of Veronica buckets, liquid soaps, and rolls of tissue paper.
So that was the President announcing the restrictions. So tonight I have three angles to this. I'll try and understand the policy behind Ghana's approach to fighting COVID-19. And I have Dr. Anthony Nsiah Asare. He is the President's advisor on health. He's also a former Director General of the Ghana Health Service. Doc, great to have you. Good evening.
Good evening, Bernard.
It's good to see you. I also have the Medical Director of the DUA Clinic, which is a general medical practice in Accra. She's also a member of the Infectious Disease Committee of the Ghana Health Service, Dr. Radna Hackman. Doc, good evening. Good to have you.
Good evening, Bernard. Thanks for having me.
My pleasure. And I also have Nana Kofi Quakyi. He's an assistant professor of health policy management, New York University School of Global Public Health. Nana Kofi, great to have you. Good evening.
Good evening, Bernard. Thank you for having me.
Great. Before we talk about the president, there's a graph I just want to show that I picked from multiple, I think it was on Dr. Radha's Facebook page, that shows the behavior of COVID infections in Ghana for the past couple of months. I just wanted to show that to the public. So from July, a peak in July of about 3,500 cases. We came all the way down to below 500 around September 26 to October 16. Rose slightly to about 1,500 in November 5, came down to November 25, flattened out actually during the election period between November 25 and January 4. Then boom, we're going up. Maybe let me ask Dr. Nsiah Asare, is this, and this is daily active COVID cases in Ghana, August to January. What is going on with this graph? What happened from January 4? Why are we having so many cases?
Yeah, thank you very much, and good evening to all the viewers and cherished listeners. What is happening is that after the Christmas festivities, which happened somewhere from 18th of December to the end of the year, there were a lot of activities. As you are aware, a lot of people came from outside the country to come for Christmas holidays. Some people came to celebrate with their families. Some came for funeral celebrations, and some came to celebrate their birthdays. I know some people came to celebrate their 50th birthday, and they never went back. So that is one. Two, every time during Christmas festivities, there's a lot of movement. I know you are going to ask me what happened during the campaign, but most likely what the virus spread mostly occurs in indoors, in confined spaces. And most of these activities, parties, weddings, funerals per se, even the funeral celebration per se is done outdoors. But the after funerals and also after weddings, this is where the problems are. Because somebody is at a party and is eating, he doesn't wear a mask. And somebody is at a funeral celebration and the after events of the funeral, nobody is wearing masks. The same thing of weddings. So these are some of the issues that we have. And that's the reason why we have seen from an epidemiological point of view, the active cases start rising. As you are aware, during those days when we had very few active cases, we had at one time where we had less than 400 active cases. We thought everything was going on well. In addition, from all these festivities, also people relaxed. Every one of us lost the guard. We all relaxed, everybody relaxed. Wearing of masks became a thing of the past. And another area that we have also seen, there's a lot of infection going on, is also workplaces. Here in Ghana, people work mostly in their offices. We don't work outside the offices. Most people don't have facilities to work from home. So people are crowded in one office, about 4, 5, 6 people. And most of the time you go there, people are not wearing masks. They are in enclosed environment, closed rooms with air conditions. And they will be speaking, talking, eating, singing, and sometimes laughing together. And that's where the problems are. So we are seeing these infections, which have given rise to the rise in
So, Doc,
cases.
you're saying that Christmas activities and people losing their guard led to the spike.
And also from workplaces.
But I want to show that graph again, because the way it spiked in January 4, there has to be something more than just that, because we can say that from August, September, people were doing normal things. It wasn't as if people were under any serious adherence. I know that activities increased in Christmas. Could it be that it was around January that the new variant came into the country? Because some people feel that new variant is probably more transmissible and possibly more virulent, which is why the graph is rising so steeply.
I think if you listen to me, I just also mentioned that a lot of people came from outside the country. We can prove that because we've done genome sequencing for the positive cases that come to the airport. We found all the 3 new variants, the South African variant, the Nigerian variant, the Brazilian variant, and also the UK variant in country. These are people that we saw they were positive with the antigen test. We tested them and did genome sequencing, and we found that. And I'm also sorry, we have to also know that we also have found the same variant also locally in some people who have not come to the airports, but already inside the country who have the virus and are sick. As you are aware, the new variant is more virulent. It infects so fast, and also when it infects somebody, the people get more sick. So we are having initially, during this period that we have very low active cases, there were some of the regions, about 4 or 5 of them, and 3 of them for a very long time, which had no cases at all. But now we have seen cases in all the 16 regions. You know that Ghana, a lot of people move around. So I'm very sure, and I agree with you, that the reason why we are having that steep rise in active number of cases is also due to the new variant.
So let me just understand something. Is the new variant imported, or it's both imported and locally generated?
Initially, I'm sure it was imported because we've seen a lot of people came from outside. And then it's now locally being transmitted locally because people brought it into the country, infected some people, and they are also infecting other citizens.
But what does that say about your airport testing then? Because we made a lot of noise about that. We were charging people money and asking them to take a test before they came into the country. If you were, even with all of that, you were still able to import the South African and the British variant. What does that say about your airport surveillance then?
Yeah, till the South African and then the Brazilian and the UK variant came in, all those who were tested positive at the airport, unless you have a comorbidity or you are very sick, we allowed them to do self-isolation at home. We know we have 3 modes of management in Ghana. We have most of the people are self-isolating at home. We have people also who are sick or who have comorbidities that we, after triaging, we keep them in hospitals or manage them in hospitals. And then you can also manage people in isolation centers. So most of them were advised, they went home, we followed them up, and they went home for self-isolation.
Okay.
So it is where maybe they contaminated the system and infected people. But since the time that we realized that the South African UK variant and it was very virulent, now anybody who tests positive at the airport is kept for 7 days and then retested. And when you are positive, then we allow you to go home. And then secondly, you also should be aware that the incubation period of the coronavirus is about 2, 3, 4, 5 days. So somebody can test negative at the airport, but he's incubating the virus, and it will take this number of days before it exhibits. We've seen people also who tested negative with PCR tests 72 hours before they came to the airport, tested negative, and went home, and after about 3, 4, 5 days, tested positive. So the testing at the airport reduces the risk, and a lot of people test positive, and then we take them out, but there are a few of them who will be incubating the virus. They may even have it when they were on the flight, and then go home and then start exhibiting the signs and symptoms, and they be tested. So that's the reason why it's happening. I'll tell you that without the testing at the airport, we would have had a lot of more cases than what we are seeing now.
Thank you. Stay with us. I'll come back to you. Dr. Hackman, when you see the graph, I think I actually took this graph from your page. What does this mean for those of you working on the ground? Because you're a member of the GMA and also you run a couple of places. That graph I showed and that thing that started from January 4, what does that mean for you, the guys working on the ground treating patients? What does that translate to?
Bernard, it translates to a lot of work. You're right about the high numbers we had in July. You're right about the numbers falling quite drastically. September, October were relatively quiet months. November, we saw a little bit of a spike. We noticed this in our facilities, but it didn't really last too long. It wasn't too bad. It came down. We went into December. We went through elections. A lot of us had readied ourselves for another spike or another wave soon after elections, but it didn't happen. Our consulting rooms and our waiting rooms remained, fairly normal.
Mm-hmm.
So things changed. For me, I noticed a big change just before New Year. Suddenly, we had a whole lot of people coming in sick, some with flu symptoms. The funny thing about, what I noticed about that time was that there were a lot more younger people, mostly in their 20s, in their early 30s. And whereas before you'd see them and they would be, very mild symptoms, nothing, to write home about. This time, a lot of them seem to have more severe symptoms. Just about them, we noticed that there were a lot more older people also presenting with flu symptoms. But the funny thing about the virus, this time, you're not seeing, it's not just the flu symptoms. We're told to expect temperatures of 38 and more. Mm-hmm. We're told to expect people with flu symptoms. But I can tell you, very few of them have that kind of temperature. And not all of them have the flu symptoms. So some come with, they come with complaints like headaches, body pains. They complain of tiredness. These are symptoms that most would associate with malaria or with other diseases. Some were coming with gastric symptoms. And around the Christmas, New Year period, it was very easy to think that, this is probably the typical food poisoning one gets around this time of the year. But you do, the blood tests, and you realize it's not malaria. You realize it's not food poisoning. You go on to do a COVID test, and it's there. It's positive, you know. That's what we saw between Christmas, New Year, and certainly within the first week of
So,
January.
Doc, are you saying that more people were coming in, and they were also coming in sicker than they were like a couple of months before?
Yes, absolutely. Yes.
So the suspicion that this was a new type of virus or a mutated version was already there, even before the genome sequencing was done?
It was either that or my personal thought at the time was that more people had gone out over Christmas, more people were exposed. And therefore, when you have a lot more people exposed, you get more severe cases because people who were hitherto maybe at home and protected from the virus were now either being exposed to it by their children who came home with the virus, or they had gone out themselves and gotten it. So the more people you get infected, the more likely you are to see severe cases.
And in terms of the severity, whereas in the past it was typically just fever and stuff, you're saying that this time there were gastric issues going on, things looking like malaria. Yeah. It looked like it was a more complicated sickness than it was a few months before.
Yeah. I mean, somebody can come into the clinic and they feel weak, they feel tired. Maybe they're diabetic. You check their blood sugar and it's sky high. And this is somebody who previously seemed to be rather well controlled. And suddenly they have a very high blood sugar. So you need to have a very high index of suspicion. You need to actually look for it. You think, why is this person so fatigued? So, and you check for COVID, and it's COVID. So clinically, it's been a bit of a nightmare, because with a whole range of symptoms that we are seeing, sometimes you almost feel like you're almost over testing, or it can present with conjunctivitis, just red eyes. It can present with a rash. So we are seeing a whole lot of symptoms now. Yes.
And in terms of
a lot more people.
In terms of the pressure on the hospitals, I know you run a private facility, but I do know that somebody like you, every now and again, be called into the public sector as well. I mean, we did a couple of reports from ICUs, and we're told some were full. I mean, how serious was the issue of hospitals getting full, treatment centers getting full?
Well, that has been another nightmare, because look, you get patients calling you in the night, or even in the daytime. These are patients who, we're involved with some amount of testing. We do the sampling, in the clinic. So we don't do the PCR test, but we take samples. So we have quite a lot of patients coming through our facilities. They test positive. And even though there are district COVID teams, which are supposed to be responsible for these patients, especially when they're being taken care of at home, they kind of know us. They're probably your patients, they know you. So when they have a problem, instead of calling the district team, they'll call you. And you need to try and get them some help. You need to try and get them into a treatment center. And it's it's difficult. It's difficult, yeah.
Thank you. I'll come back to you. Nana Kofi, I've read a lot of the things you've written about COVID in terms of our testing strategy and all of these things. Which aspect of our strategy do you think let us down for this spike to gain ground? Because yes, I do know that all over the continent there are spikes, but it would seem to me as if Ghana's situation is pretty dire. In fact, I have a graph I will put up shortly, which shows African countries and their new cases over a period. And Ghana is easily among the top 5 in terms of new cases. South Africa has plus 4,500, Tunisia plus 1,400. And in fact, Ghana's new cases over the period was the second highest, only after South Africa. So clearly, even though every country is seeing an increase, there does seem to be some. Yes, this is what I've put up, Nana Kofi. So which aspect of our strategy went wrong, in addition to all that has been said, for us to get here?
Well, good evening, Dr. Hackman. Good evening, Dr. Nsiah. Asare. Thank you. Pleasure to see you. I think it's important to caveat the question of the testing numbers you just showed, with the case numbers you just showed, with the fact that testing in Ghana has been increasing pretty substantially since the end of December all the way through to now. Towards the end of December, actually even for months, really September, October, we're on our 7-day average of in-country tests was usually under 1,200. And right now it's about 4,000. And as we test more, because of the external spread in the communities, as the testing numbers go up, we're also seeing an increase in the cases. So there's a part of it that's just because we're testing up 4 times the rate basically that we're doing in December. So that's part of why we're seeing the sudden spike. South Africa, for example, had been testing at a pretty high rate and pretty consistently, and a few other countries too. So it meant that you wouldn't see as sharp a spike just because of testing changes as you see in Ghana. But it is clear that in Ghana, we are having a pretty significant escalation. I think when it comes to it's not just a question per se of a testing strategy. I think it's a question of how effective we've been at breaking transmission. We knew, for example, that the UK variant was sequenced in Ghana in early December from travelers arriving at the airport, to spread around from a variant that had already been said to be more infectious quite considerably, and that was likely to have some more severe complications as well. We now know that severe complication is a 30% greater chance of mortality. But in the window that followed it, is around the time where like Dr. Hackman said, like Dr. Nsiah said, we saw a lot of activity in the holiday season with parties and all that stuff. Now, those made it so that if you had those viruses coming in and they were, weren't able to catch all the cases at the airport, we're going to have some extent of community spread. But that opportunity that was created in December, where there were large congregate gatherings, pubs were open, bars were open, there was no mask wearing at a lot of those locations. Those were really what contributed to that. So it was really a question of enforcement of all the transmission control measures, especially at a time where there was an early signal that we could have a more tricky strain or variant of the virus to deal with. And I think it's in that window where our timing on the closures and enforcement and reinforcement of some of the measures and reimposition of restrictions were a little bit tardy that we saw that significant spread. So it really goes back to a question of transmission control and how effective we've been at communicating that to the public to take it seriously, and how effective enforcement and policy has been at making sure that we can slow that down.
Great. We'll take a short break. This is the point of view. We're trying to do two things. We're trying to understand why the COVID cases are rising so much, and also trying to examine the president's proposal. So when we come back, we'll look at some of the tightening of the restrictions and what that actually does. My guests are Dr. Nsiah. He's the president's advisor on health. I have Dr. Radna Hackman, who is a medical doctor, a member of the Infectious Disease Committee of the Ghana Medical Association, and Nana Kofi Quakyi, who is a public health expert. We'll be back. Stay with us.
It's a good day to meet every challenge. It's a good day to want more out of life. It's a good day to wish for it, work for it, go get it. Familiar taste, a delicious indulgent with a flavor you just can't hide. Refreshing energy gives so much for so little. For a strong performance, you've come to the right place. Good Day Energy Drink. Why wait a minute to enjoy a good day when every second counts? Good Day Energy Drink keeps you going.
Excessive drinking can be detrimental to your health. Not recommended for persons under 18 years, lactating mothers, pregnant women, and people sensitive to caffeine. This advertisement has been vetted and approved by the FDA.
Let's take a moment to talk about money. Life can get a little pricey out there. The passing pleasure of a restaurant meal, a fleeting fast food feast, or those sports magazines you never really finish. But what if you got to watch the big game rather than read about it? And what if that lasted a lot longer? Well, with DSTV, it can. Because with a whole range of different package options to choose from, you can get a whole month's worth of moments for both you and your family at a price you can afford.
I am so excited.
That's right. Only one in exchange for hours of sport, lifestyle.
Love is a game of cat and mouse.
International, local, and kids entertainment.
Let the nerds take over.
It's your moment to enjoy all the moments with DSTV.
Welcome back. This is The Point of View. It's our first edition for the month of February. We're asking, why is COVID-19 still a huge issue? Where is the spike coming from? We have three guests. Dr. Nsiah is the President's advisor on health. He used to be the Director General of Ghana Health Service. Doc, thank you for staying. We have Dr. Radna Hackman. She runs DUA Clinic. She's also a member of the Infectious Disease Committee of Ghana Medical Association. And Nana Kofi Quakyi, who's a public health expert at New York University. All right, now, Dr. Nsiah, the President spoke yesterday. No funerals, no weddings, no parties, no theatrical performances. Conferences can happen, but they should be done as much as possible virtually. Restaurants and bars, some interesting restrictions. What is the psychology behind these new restrictions? Some are asking because they're saying, for example, for a wedding that you ban, you've not banned church services or whatever. So what's the thinking behind the specific things you chose to ban? Kindly put on your audio. We can't hear you.
Thank you very much. Can you hear me?
Yes, we can hear you.
Yeah, it's very simple. The thinking is that, as we said, the virus spreads in indoor spaces where the place is closed, air conditioned, and there are a lot of people in the room not observing any social distancing, not wearing masks. That's as simple as that. And we realize that, I'm sure Dr. Ryder will tell you, if you take the history from most of these patients who went to the hospitals and are positive, they will tell you where they've been.
Yeah.
A lot of them have been to weddings. The weddings, per se, is not the problem, but the after wedding, the reception, where people are eating and drinking and dancing, singing and laughing. And when there's music playing, you have to be very close to whoever that you are conversing with or you're interacting with. Funerals per se were banned. What was allowed initially was private burials first of 25, we went to 100, and then people were just asking everything to do exactly what you want to do. But the after funerals, the events after the funeral, that's where the problem is. You can see about 200, 300, sometimes 500 people within an enclosed. Now there's even something which is happening in this country where people hire tents, air conditions inside the tents, and they'll be eating, drinking, and all sorts of things going on in there. The pubs, a lot of people who came in for the holidays went and enjoyed themselves in the pubs, dancing without mask. Everything happened without mask. So these are areas where it was difficult to control during the holidays because they came to enjoy themselves. That's the reason why we have done this thing before. The virus moves with where people are. It moves where there's a lot of concentration of people, especially in an enclosed area. So to go back to what we did, the restrictions we put in place, which worked for us some time ago, we went back and said that we are going to restrict these activities, wedding, funerals, activities like going to theaters to watch theatrical things, and also making sure that people don't congregate at these places.
So why didn't you say anything about public transport? In the previous one, there were social distancing protocols for public transport, but this time around, he didn't say anything about that.
Yeah, we didn't say anything about public transport because we realized that if people are in public transport and they put on their mask throughout the journey and use sanitizers in and out of the transport, the risk is minimal. So the most important thing is to follow the protocols and make sure that people are in masks. In public transport, you can control that. You can, in the bus or in the trotro or in taxi, everybody who is sitting down there, there are not too many people there, and the driver and the mate or the conductor can insist that if you don't wear the mask, you don't enter this place. That is what is happening.
Now,
anywhere you can control, you control. I'm sure you are going to ask me about church.
No, not that, not church. I wanted to go to borders. Our land borders are closed on paper, but there is a lot of, in fact, on my radio show, a lot of people tell me that people are coming into the country in droves. So there are two in one question. The air border, which seems to be more risky, is open because the variants are coming from colder climates, and most of those will come by air. The land border, which has these three neighboring countries, which have similar characteristics to us, is rather closed, and yet people are coming in artificially. What's the reasoning behind the way you are managing the borders?
We are managing the borders in such a way that the land and the sea borders remain closed. I'm sure the most important thing is how are we making sure that people are not passing. His Excellency the President has charged all the security agencies, especially immigration, to also make sure that the borders are closed. The Director of Immigration or the Controller of Immigration has been called and told that he should man the borders very well. Luckily, in Ghana, we have only one entry into the country by air. That's why we put the testing regime there to make sure that nobody crosses. If you remember, one of our policies, the 6th policy that we started with, is limited importation. So we manage that all the people who are coming by air, we are going to limit the importation. That's why we put the testing regime there. Ghana's borders are about 52, the last time that those who are even manned by immigration people. There are other unauthorized areas where people pass. And what government is doing, which the president has charged the immigration people to do, is to make sure that all these borders are controlled and then managed in such a way that people don't come in. We are going to do exactly what we were doing before at the beginning of this pandemic in March. So we put security agents at the borders and make sure that nobody crosses the borders. I agree with you. I've been hearing a lot of people have been telling me, I went to Togo and came back yesterday. I went to Nigeria and came back 2 days ago. And this is what we are going to do from now on to make sure that all the restrictions we have put in place, we have to make sure that the restrictions are enforced.
So in terms of enforcement, how are you going to enforce, for example, the closure of pubs? Because we are also told that during the Christmas, a lot of pubs were operating, okay, and even nightclubs were operating. So is it like police are going to go out? Are you going to use the industry association? Because in Ghana, it looks like we have a lot of laws, but nobody really enforces them. That's the problem.
Yes, for the pubs and the nightclubs and the cinema halls, what I've seen today is that the regulatory authority of the tourists and then the industry have sent out a release to all of them that these are the restrictions. These are the ones which are banned. So please don't go there. And the next thing that they have to do is to put big posters at these places, that these places are banned. And then the police can also be stationed there. That's what we are going to do. The police will be stationed there to make sure that people don't go there. Once people see the clientele or the clients see that there's a poster or a notice on the walls of those areas, a lot of people may not even attempt to go there. And the police will make sure that anybody who attempts to go there will go and make sure they do some arrests, including the owners of these pubs and nightclubs.
Okay. Let me come, Dr. Hackman. Doc, based on your interaction with patients, where are they getting the COVID from? Can you tell me, is it the parties? Is it the workplace? What are the main places that they are bringing it from?
They're getting it from social activities, social events like parties, like clubs. They're getting it from weddings. They're getting it from funerals. They're getting it from the workplace. And it's easy to tell, when they come to us sick, we take a history, and the history comes up very, very clearly. They'll tell you they went to this function. Somebody they were sitting with at a table has since tested positive and has called them to let them know. They come to test usually for reasons like that. So they tell that they were at a funeral and the people that they were with, now they hear that, so-and-so has got it, so-and-so has got it, and they come because of that. So when they come to you, sometimes they know that, they know exactly where they got it from. Other times they come, like I said, they come with symptoms. Bernard, it's really funny, because you listen to them, you get their history, or you get their symptoms and everything, and you suggest, you know what, we've done so-and-so test, I think you should do a COVID test. How? Me? How? I mean, they almost sound as if you're accusing them of having some unmentionable, disease. So the other thing that comes out a lot in the history is, by the time they come to you, they've taken every single medicine in the book.
They're already treating themselves.
Medicine. Bernard, they've taken, they talk to their friends who've had COVID before. By the time they come to you, they've taken azithromycin. Of course, everybody's taking the zinc and,
vitamin C.
And the vitamin C. Some, Bernard, you see, there are about there are 3 stages of COVID. I must make this very, very clear.
Mm-hmm.
There are 3 stages of COVID. So the first is, asymptomatic and mild. Then you've got the moderate, and then you've got the severe.
Mm-hmm.
And the treatment for each stage is different.
Okay.
So the treatment for asymptomatic, mild, as soon as you start getting to moderately severe to severe, the treatment completely changes. Okay. And an important tool we have in the management of COVID is a pulse oximeter, which certainly all high-risk patients should have, because this tells us very clearly if they're monitoring themselves at home. You can tell when one is moving from one stage to the next, you see. And there is no place for the treatment of severe COVID in the home. By that stage, you should be in the hospital. So when you hear that, somebody has got COVID and he can't breathe, and he's at home and he's taking oxygen. And by the way, people are buying oxygen tanks. People have oxygen in their homes.
At home?
Yes, Bernard. Yes. And it's actually dangerous to treat a severe case of COVID in the house, So you get a mild case of COVID coming into your clinic, and they've already put themselves on drugs like steroids, which are meant for severe cases. You take it in the mild or asymptomatic stage. And what it does is that it suppresses your immune system, and you're more likely to progress from mild to severe, you see.
So self-medication can actually kill you.
Self-medication can actually make your situation worse. It can actually kill you, because drugs like azithromycin are prescription drugs. Not everybody can take it. If you have certain heart conditions and you take azithromycin, it can give you a dangerous rhythm of your heart. And in fact, it can kill you suddenly, you see. Yes, but by the time they've come, and the doses, they don't know the doses. Somebody says, I took it for 6 days. Somebody says, I took mine for 7 days. Or somebody says, I took it for 5 days. It didn't get better. So I repeated it, And these are some of the problems we have with managing COVID.
Okay.
Everybody is reading a lot, and some people are just doing the wrong thing,
Okay. Let me come to Nana Kofi. Nana, so just in terms of our strategy, the president also announced a vaccine program that's going to come in. And he basically was saying we're going to get the first batch in March, the main chunk by end of June, and that we're hoping to vaccinate about half of the population. Should our focus be on the vaccines at this point in terms of our strategy, or is the vaccine still far ahead? If you are advising government on what we should do between now and June, is vaccine the priority now?
Well, vaccine acquisition and planning for distribution and storage obviously has to be an immediate priority. The sooner we can get the vaccines in country, the quicker we can actually start to build up a herd immunity against this virus. Ghana is part of the COVAX facility, one of 92 countries in it. Of those 92 countries, about 67 of them, as of mid-December, hadn't really yet made any independent procurements. And at that time, Ghana was one. But beyond the COVAX, we're also relying on what the African Union is doing with the African Vaccine Acquisition Task Force, where, the African Union under Cyril Ramaphosa have been able to now get about 670 million doses that are going to be rolled out between 2021 and 2022. And very much like COVAX as well, we're going to get about 600 million doses total for these low-income countries and middle-income countries. But only about 50 million of them will be free in Africa for 2021. So we do need to be prepared for the kinds of vaccines we're going to pick. Is it going to be the Pfizer, Moderna? What does that mean about cold storage and distribution? We need to be planning for all those things. But we also need to understand that until we've hit that 60% threshold for vaccine-acquired herd immunity, we still have to be able to do all the non-pharmacological interventions like mask wearing, like physical distancing, that buys us time, that slows down the rate of transmission. And in there is where I think communicating that clearly to the public is really critical. People have to understand that, yes, there's a light at the end of the tunnel, but we're still going to have to walk the distance. It's going to take time. We're going to have to understand that if you're an employer, you have to be making provisions for work from home, not just for 2 weeks or 3 weeks, but months at a time, because in reality, we're going to have to balance those things. But yes, we should be focused on the vaccine, but short term, it's about really doubling down on all the things we know work: physical distance and mask wearing for people who have to go into offices, considering using better masks, not just maybe the fabric mask, but upgrading to masks that also are not just source control, but can filter out some virus particles like the KN95. That might not be a bad recommendation to give, but we need to figure out how to titrate all the basic things we're doing so that they can meet the moment, because now we're dealing here with a more infectious strain, so we need to deal with that from a transmission perspective, and a more severe strain where it could overwhelm the healthcare system, which is already at its limits for critical care.
Is there a problem with our communication strategy? In the first few months, I heard spread calm, not fear. Does that message defeat the urgency of take care, don't go out, wear your mask? Is there some disconnect in the spread calm, not fear, and the urgency of the now?
Well, I think we want to communicate to people the reality of the situation, and we want to do that with candor and with transparency about what the reality is. I think it's important for people to have an accurate appreciation of the risk on the ground. And even if we are saying we should not be spreading fear, it's important to also make sure that people understand that there is something out there to be afraid of, even if there's not. We should not be having a mass panic about it. There is actually a deadly virus in circulation. We know that we have a more severe strain of it now that's spreading quicker, a couple of them truly. And it's important that we are able to let people understand the fact that that is the reality. There are a lot of people, you've covered this, you've heard a lot of the man on the street interviews where people say, COVID is not that deadly, people are not dying, all that stuff. But it's important that we understand that, every life that's lost here is it's someone's family, someone's brother, someone's father, someone's mother. And we should value lives enough to make sure that the goal is to keep that to an absolute minimum of 0. And part of what that means is making people aware that 1 death, 2 deaths, 300 deaths, it's still a problem. We have to make sure that we are keeping that down. I think in the communication, it's also important that people get good cues about what they should do. For example, I think in the case of the members of parliament who are refusing to get tested, I think that's very problematic and unhelpful. We have to make it clear to people that if you're going to be in a workplace where you're sharing the space with other people, you owe them a duty of responsibility to make sure that you're not putting them at risk. And part of that means that you have to make sure that you yourself are not a risk factor for them by going to get tested, by isolating, by quarantining, by doing all those things. If people are looking at members of parliament, saying that they're not going to do that or dragging their feet to that, it doesn't help reinforce the messaging that this is important enough that when we say we have to do testing on time and tracing on time and quarantine on time and isolation on time, that those things actually matter.
Okay. This is still the point of view. When we come back, we're going to deal with some of the serious myths and concerns. So there are issues about hydrogen peroxide. It's a big issue. In fact, we would read a report. We are told they can't even get some in the shops. Does it actually treat COVID? And there's also a lot of conspiracy theories about the vaccine. And how are we going to convince people to actually take the jab if we get it? It's not just procuring the vaccine, because there are some people who say, I'm going to take the vaccine. And this includes people who may even be health workers. We'll come back to that. This is the point of view. Stay with us.
Everything seems to get a little more expensive this time of the year, but keeping your family entertained doesn't have to. Now you can get a GoTV decoder with 1 month of GoTV Plus for the new low price of 89 CDs. That's 24/7 access to your favorite local stars, the biggest names in the game, international movies, and plenty to keep the kids busy. It's a deal you can't afford to miss, so don't delay. Get the limited time offer today. GoTV. Love it.
It's a good day to meet every challenge. It's a good day to want more out of life. It's a good day to wish for it, work for it, go get it. Familiar taste, a delicious indulgent with a flavor you just can't hide. Refreshing energy, gives so much for so little. For a strong performance, you've come to the right place. Good Day Energy Drink. Why wait a minute to enjoy a good day when every second counts? Good Day Energy Drink keeps you going.
Excessive drinking can be detrimental to your health. Not recommended for persons under 18 years, lactating mothers, pregnant women, and people sensitive to caffeine. This advertisement has been vetted and approved by the FDA.
Welcome back. This is To The Point of View. I have three very interesting people. Dr. Nsiah Asare is the President's Advisor on Health. That's a huge position. I'm talking to him on the policy issues. Dr. Radna Hackman is a practitioner, member of GMA. She runs the DUA clinic. She says COVID is very serious. We shouldn't joke with it. And of course, I have Nana Kofi Quakyi, who is a public health expert. Doc Nsiah, there's a question for you that I'm going to read out, and then I'll ask you two final questions. So this one says, good evening, Bernard. Sorry to bother you. I am at KIA now. They are still charging $150 for entry COVID testing, irrespective of the president's directive for $50 for ECOWAS members. I came on Kenyan Airways. The excuse is that it hasn't taken effect. Doc, I know this person myself. I know he went to a West African country to do something, and he's coming back through Kenyan Airways. How come they are still charging $150? We need your quick response to that.
The president yesterday said from ECOWAS country summit, which I attended, that any ECOWAS citizen who is coming into the country will pay $50. Mm-hmm. Non-ECOWAS citizens will pay the same amount of money that they used to charge.
Yes.
The $150. So I'm not too sure if he's an ECOWAS citizen.
No, he's a Ghanaian. He's a Ghanaian. He went to a West African country via Kenya Airways, and they want to charge him $150. And he's standing in the queue now as I'm talking to you. He's actually watching the show. That if he wants you to tell them it's $50, otherwise he won't pay.
What I know is that the president spoke yesterday. There's supposed to be a note verbal which will go to all the airlines. And I think it has to go first before the directive starts working. So I'm very sure that they haven't started implementing, because they have to inform all the airlines. Normally, the Ghana Airports Company informs the airlines before these things are taken into action.
Okay.
So I can't tell. I think after the section, I'll call the
you check.
Check.
All right.
If he has sent the note verbal.
The president said the first batch of vaccines will come in March. Do we know how many vaccines are coming in March and who will benefit from that batch?
Yes, thank you very much. We have a very comprehensive vaccination rollout, which involves registration of the vaccine, selection, and then we have what you call segmentation of the people who will get the vaccine. We've segmented the population into the frontline workers or health workers in general, the people at risk, that's people who have comorbidities and immune suppressed patients. We have also the media or the essential services people, media, electricity, and other essential workers. Then we have also the arms of government who also have theirs. They are also segmented into a group. And then the other population who are not part of the first three segments that I've said, but also need the vaccine. The first batch of the vaccine, the president said, will come in March. As I know, that we are expecting the first batch of the COVAX vaccines, which Kofi spoke about. We are supposed to get about 20% of those vaccines, which we have about 6 million. But apart from this, Bernard, we are also getting vaccines from some bilateral organizations. And we are getting also vaccines from private sector who have agreed to give us buy vaccines for their companies, but they will also give government any vaccines that they buy. The amount they buy, they will give government also the same amount of vaccines. So we are sourcing this vaccine by Ghana government, apart from COVAX, which is coordinated by Gavi. Ghana government is going to also procure its own vaccine. And then we have other organizations like Tony Blair Foundation, who is also helping us to get some of the vaccines from the UK. And then we will make sure, as the president said, that we want to vaccinate all Ghanaians. But our target is to get 20 million of the population vaccinated so that we move towards herd immunity, as Kofi said.
Okay. Thank you. Dr. Hackman, what is the most important thing that needs to be done for health facilities now that we are in the midst of this spike? What's the most important thing that needs to be done for health facilities?
Bernard, I work in the private sector, and forgive me if I spend more time talking about the private sector than I do the public sector.
Mm-hmm.
The private sector has almost been struggling for a role to play in this pandemic. Something that surprised me a couple of years ago was when I found out that, the private sector doesn't actually fall under the Ghana Health Service.
Mm-hmm.
In fact, we don't even have a directorate in the Ministry of Health. The last I knew, we just had a desk in the Ministry of Health. I don't know if that desk is still standing.
Mm-hmm.
So sometimes we feel very left out when some of these decisions, are being made. We almost, like I said, have to struggle to look. We all have the same objective. We're in a pandemic. We all have a role to play. I think the private sector looks after maybe 50%, some say even 60% of the population. A lot of these patients actually come to us. A lot of them are actually diagnosed, from the private sector.
Mm-hmm.
I would wish that we're giving a more enabling environment to help us also play a role. For example, we have the district. Every district has a COVID team, which is made up of doctors, nurses, psychologists, and everything. And you'd be surprised to know that there isn't any private sector representation in these.
So more support
teams.
for the private sector.
More support for the private sector. Bernard, you sometimes you might ask why testing is so expensive in the private sector. And I'll tell you that, duties are actually imposed on the equipment, the PCR machines that are
and
used,
the reagents
to test, and the reagents, you see, and the duty is as much as 40%. So look at a typical person in private sector also trying to play a role.
Look, we have to leave it here, but I think the point is well made. The private sector needs support, and the issue of duties, I'm told, is something we should be talking about. Thank you. Nana Kofi, sorry I couldn't bring you into the last question, but I want to thank all of you sincerely. My guests have been Dr. Nsiah Asare, who's the Director General of the Ghana, former Director General of Ghana Health Service, now President's Advisor on Health, Dr. Radna Hackman. She's the Medical Director of Dua Clinic and a member of GMA's Infectious Disease Committee. Nana Kofi Quakyi, who's an Associate Professor, Department of Health Policy Management, New York University School of Public Health. Thank you, ladies and gentlemen, and thank you for watching. My name is Bernard Avle. Please stay safe, mask up, and let's kick COVID out of Ghana. We'll see you next time. Stay with CCTV. Bye-bye.